Actually, studies have shown that over time, people lose about the same amount of weight with lap band and gastric bypass, but there's a lot of bad information out there that says you won't lose as much weight with lap band. It's not true.
So it's malabsorptive because they're rerouting.
And they're taking out a portion of the small intestine, which absorbs all the nutrients. So with that removed, you only have the amount of time going through a smaller portion of the small intestine to absorb everything.
And it's restrictive because they also do make your stomach smaller.
They make your stomach smaller, yeah. I sort of elaborated just on this type because of the type that I had, and it would take up a lot of time to go over all the surgery techniques. Many complications related to gastric bypass do not exist with gastric banding. Gastric band complications are less frequent, less severe, and usually fixed as outpatient, so you won't have to be back in the hospital. You can just go in and they help you out and you're out of there. Mortality rate is much lower with lap band, extremely lower. Unfortunately, there are a number of people that get gastric bypass and end up passing away because of complications. Why is weight loss surgery so popular? Like, why can't I just go on a diet and lose the weight? That's what my dad says. Why don't you just go on a diet? Why don't you take your iPod and walk around the field every day 20 times? And I was like, it's kind of insulting when people say that because it's like I've tried that my whole life. Like, I've been overweight my whole life, so obviously I've tried that. A lot of people just never feel full. The nerves at the top of your stomach are what tell you that you're full. Like when food gets up to the top, you get a signal to your brain that says, I've eaten enough, I'm full. For a lot of people, those nerves are faulty, and so you never actually feel full. For me personally, I could eat all day and still be hungry. Like, I could always eat. If you put food in front of me, I will eat it. And now I can't. It's the only way that I had control over myself as a compulsive overeater. But why is weight loss surgery so popular? Well, bariatric surgery is popular because it's the most effective weight loss option for people whose obesity poses a major health problem. With so many health problems related to obesity, this is the only way to eliminate them. If you're that much overweight, it is the best option. It also alleviates life-threatening complications of obesity such as diabetes, high blood pressure, and high cholesterol. Okay, I found this really awesome study. It's a Kalodikin study. Psychologists Runit Kalodikin, PhD, wondered whether people who undergo weight loss surgery actually benefit. She led a team that looked at 3 matched groups of obese people, 223 gastric bypass surgery patients, 110 people who were denied weight loss surgery by their insurance providers, and a comparison group of 189 people who did not seek surgery. 2 years after surgery, patients averaged 34% drop in body weight. Those are the people that had surgery. Those denied surgery managed to lose 6% of their body weight, and those who did not seek surgery actually gained 0.6% of their body weight. All of the study subjects fill out quality of life questionnaires at the beginning of the study. Nearly all surgery patients, 98% of them, reported meaningful increases in their quality of life. This was true for only 46% of those denied surgery and only 30% of the comparison group. So do you guys know any celebrities that have had weight loss surgery?
Oh, yes.
Al Roker.
And then the
Al
guy.
Roker.
Oh, yeah. Al Roker.
Who else?
Ricky Lake.
Oh, she did?
Ricky Lake actually didn't have surgery. She lost all that weight on her own.
Carney Wilson.
Did Missy
Who?
Elliott?
What's her name? Carney, the one who.
Carney Wilson. Yeah,
that's
she
what
had
I was
gastric
thinking.
bypass.
I don't know if Missy Elliott.
I think she just went on a diet.
I think. Is it? I just knew that.
Did Queen Latifah or Sharon Osbourne?
Sharon Osbourne.
Sharon
has
Osbourne.
lap band. Queen Latifah is still big as far as I
I know Queen Latifah had like breast reduction surgery.
know.
How about Star Jones?
Star Jones,
Yeah.
for sure. She had gastric bypass, although she hasn't admitted it to the media. A lot of people already know. So yeah, celebrities with weight loss surgery kind of brought it to the front lines, and so made it more acceptable, because there's a huge stigma related to people that have weight loss surgery. For example, the way my dad reacted to it was just like, I'm weak, or someone that seeks weight loss surgery is weak, they don't have self-control, they don't have willpower. And a lot of this isn't true. There's a lot of people that go through every diet in the book and just cannot lose weight. So Sharon Osbourne had lap band surgery. She used to be really big back when her and Ozzy were together. And then she had lap band surgery and lost a lot of weight. I'm not exactly sure how much. But look at her now. She looks pretty hot. Carney Wilson had gastric bypass surgery that was actually filmed and streamed live on the internet. I didn't see it, but it sounds cool. Star Jones had gastric bypass surgery. She lost a lot of weight. She was really big. Carney Wilson was really big too. She was over 300 pounds.
Seems like she's big again though, huh?
Carney Wilson's actually regained a lot of her weight, and like I said before, creating that small stomach that can be stretched out is a huge con to gastric bypass because you can stretch it and then regain your weight. And the malabsorptive aspect of it only does so much. But there are other things that can make people regain their weight too that we'll talk about later. Underlying behavioral issues. As you can see, surgery is a mechanical process. All it does is make the weight come off. That's all it does. If we're not addressing how people became obese, then we don't know if it's going to work in the long term. Though there is extremely limited research available studying the significance of behavioral issues as they relate to long-term maintenance of weight post-op, it is beginning to be recognized that obesity, even after bariatric surgery, is an issue that requires recovery. Eliminating the consequences of one form of compulsive behavior, i.e. overeating, is not dealing with the underlying cause, and if that cause goes untreated, people often find themselves engaging in equally destructive behaviors in the place of previous ones. Behavioral adaptation is required for a successful outcome. Weight loss surgery does not address the psychological and emotional issues behind why people eat themselves into obesity. Patients who proceed with weight loss surgery without addressing their own behavioral issues are at high risk for self-destructive behaviors that have the potential to outweigh the health risks of their obesity. Obviously, this is just referring to the people who have overeaten themselves into obesity. Obesity occurs for a lot of other reasons. Health issues could be a reason, but I'm focusing mainly on the psychological issues. Yeah, this is all that I already talked about. Doesn't address the psychological issues or the emotional issues. Patients who proceed with weight loss surgery without addressing their own behavioral issues are at high risk for destructive behaviors. Life adjustments post-op. Issues that people can encounter post-op are many. So I thought I'd go over a few of them that I've seen and that I think are the most prevalent. Body image issues. Body image issues, including body dysmorphia, are very common among post-op patients. Body dysmorphia is where the affected person is excessively concerned and preoccupied with an imagined or minor defect in their physical features. A lot of people who are losing a lot of weight become really perfectionistic with their appearance and sometimes abuse the tools of their surgery to lose an unhealthy amount of weight. Disappointment. What happens when you're manifesting your hopes in this surgery and you think once you lose all your weight because you've been obese your whole life, it's going to solve all of your problems. People are going to like you more, they're going to accept you, you're going to get that job you always wanted, you'll finally be happy, everything's just going to work out. A lot of the time that doesn't happen. What happens is you lose weight and everything else is up to you. And a lot of people get really disappointed with that, disillusioned, go into depression, and they harness a lot of anger from that, and sometimes it's directed outwards into their relationships, which can be very destructive.